Welcome to the INHE Module 2 Kinesiology Guided Review. In this review, we are not simply going to memorize answers. Instead, we're going to focus on understanding concepts, visualizing anatomy, and thinking critically about movement, bones, joints, ligaments, and muscles. As you listen, try to picture the structures in your mind and think about how they relate to massage therapy, posture, pain patterns, and movement. Let us begin with the foundations of kinesiology. Kinesiology is the study of movement. Think about the word itself. Kines relates to movement, while ology means the study of something. As massage therapists, understanding movement is critical because dysfunction, pain, posture, and muscle imbalance are all connected to human motion. When studying the shoulder girdle, focus on the two primary bones that create the framework of the shoulder region. One is commonly called the collarbone, and the other is known as the shoulder blade. Know where these bones are located, how they articulate with each other, and why the shoulder girdle allows such a large range of motion. Pay attention to the clavicle. One end connects near the sternum at the center of the chest, while the other connects laterally near the shoulder. Understand which joint is located at the medial end and which joint is found at the lateral end. Think about injuries athletes commonly experience when falling directly onto the shoulder. Move into the upper extremity and review the forearm bones. One bone is positioned laterally in anatomical position, meaning it is on the thumb side. The other is medial on the pinky side. Learn how to identify them both. At the elbow region, study the bony projection that forms the point of the elbow. Think about which muscle inserts there and what movement that muscle creates. The wrist contains a group of small bones. Rather than memorizing randomly, think about the root word related to the wrist. Know how many bones are located there and understand why the wrist is capable of such flexibility and fine movement. One bone of the upper body is especially vulnerable to fractures during falls or shoulder trauma. Think about the thin, curved bone running across the upper chest and why direct impact commonly affects it. As you study the wrist joint, understand the relationship between the forearm and the wrist bones. Focus on which forearm bone primarily articulates with the carpals. Now move into the pelvis and lower extremity. The pelvis is composed of 3 fused bones. Study their names carefully and identify which region forms the broad superior portion, which supports body weight while seated, and which forms the anterior portion of the pelvis. One region of the pelvis forms the socket for the hip joint. Understand its shape, depth, and role in stability. Compare the hip joint to the shoulder joint and think about why the hip sacrifices mobility for stability. Review the scientific name of the hip joint and notice how anatomical terminology often combines the names of the structures involved. At the knee, focus on the relationship between the femur and tibia. Think about which structures provide stability during walking, running, twisting, and pivoting. One ligament inside the knee is especially famous for sports injuries. Review where it is located and why sudden directional changes commonly damage it. At the ankle region, identify the prominent bony landmarks on both sides of the ankle. These structures come from the distal ends of the lower leg bones. The heel bone is extremely important clinically because it absorbs force during standing and walking. Study its location and understand its relationship to the Achilles tendon. Review the structure connecting the kneecap to the tibia. Think about how force generated by the quadriceps travels through this structure to extend the knee. Now let us review the skull, thorax, and vertebral column. Behind the ear is a prominent bony projection that serves as an attachment site for muscles, such as the sternocleidomastoid. Be able to locate and palpate this structure. Within the sphenoid bone is a saddle-shaped structure that houses an extremely important endocrine gland. Review both the structure and the gland associated with it. When studying the ribs, pay attention to classification. Some ribs attach directly to the sternum through cartilage, while others attach indirectly or not at all. Understand the differences between true ribs, false ribs, and floating ribs. Review the joints formed between the ribs and thoracic vertebrae. Think about how these joints contribute to breathing mechanics and thoracic movement. The sternum contains three major regions. Study the superior broad portion, the long central body, and the small inferior tip. On the back of the spine are structures that can easily be palpated along the midline. Massage therapists frequently use these landmarks for orientation and assessment. Inside the intervertebral discs are two important structures. One forms the tough outer ring, while the other forms the softer gel-like center. Think about disc herniations and which structure may bulge outward. Study the processes that project laterally from the vertebrae and understand their role as muscle attachment sites. At the upper cervical spine, understand the relationship between the first and second cervical vertebrae. One is specialized for nodding movements, while the other allows rotation. Review the first cervical vertebra carefully and understand why it received a name associated with mythology and support. Spinal nerves leave the vertebral column through openings located between adjacent vertebrae. Think about how narrowing of these spaces may contribute to nerve compression symptoms. Now, let us move into important muscles and muscle actions. When studying muscles, avoid simply memorizing names. Instead, think about origin, insertion, fiber direction, and action. One muscle elevates the scapula. Visualize its fibers running from the upper cervical spine down toward the scapula. Another group of muscles pulls the scapula toward the spine. Think about rowing movements and good posture. Now, think about antagonists. If one muscle retracts the scapula, another muscle must protract it. Review how muscles often work in opposition to create balanced movement. Several muscles attach to the coracoid process. Study which muscles connect there and whether they originate or insert at that structure. One smaller chest muscle is clinically important because tightness may compress nerves and blood vessels traveling into the upper extremity. Understand its location beneath a larger chest muscle. When studying shoulder extension, think about powerful pulling movements such as climbing, rowing, or swimming. Which large back muscle strongly contributes to extending the humerus? The rotator cuff muscles are extremely important clinically. Instead of random memorization, learn the famous acronym used to remember them. Also understand where each is located on the scapula and what movement each creates. One rotator cuff muscle is unique because it lies on the anterior surface of the scapula rather than the posterior surface. Review why this muscle is especially important for medial rotation. Another rotator cuff muscle lies directly below the scapular spine. Picture the posterior scapula and identify the spaces above and below the spine. The deltoid muscle is divided into three regions. Study how each region contributes differently to shoulder movement. Certain chest muscles may produce referred pain patterns that mimic cardiac symptoms. Massage therapists should understand these referral patterns clinically. Review the insertion of a biceps brachii carefully. Think about how this muscle contributes not only to elbow flexion, but also to forearm supination. One major muscle inserts on the olecranon process and serves as the primary elbow extensor. Visualize pushing movements and how this muscle contracts. The anterior forearm contains many flexor muscles, while the posterior forearm contains many extensor muscles. Instead of memorizing individually at first, understand the overall organizational pattern. Finally, remember that kinesiology is not only about memorization. It is about understanding relationships. Think about agonists, antagonists, and synergists. Agonists create the primary movement. Antagonists oppose or control the movement, and synergists assist or stabilize. Also think clinically. Tight agonist muscles may pull the body into dysfunctional posture, while overstretched antagonists may become weak, fatigued, and ischemic. As you continue reviewing, focus on visualization, repetition, and understanding movement patterns. Try to palpate landmarks on yourself, observe posture in others, and connect anatomy to real clinical scenarios. Thank you for participating in this INHE Module 2 Kinesiology guided review. Continue studying consistently. Visualize the structures often and focus on understanding rather than simple memorization.